Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now, you might be wondering what's going on in this image here. These various histologic representations of a parathyroid. Well, this is a bit esoteric, but we will be discussing parathyroid gland pathology, specifically what you need to know. And all this is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material. Parathyroid, right? Those four glands. They secrete parathyroid hormone. And parathyroid hormone boosts bone osteoclast activity and releases calcium and phosphate into the serum. PTH also improves calcium and phosphate absorption in the small intestine by indirectly activating vitamin D and leads to elevated serum ionized calcium levels, which act as a negative feedback loop to reduce PTH secretion while decreasing phosphate reabsorption and increasing renal calcium reabsorption. And by the way, you're going to need to know where that phosphate reabsorption takes place, which is the proximal tubule, and the calcium reabsorption, which is the distal tubule. Here we have a representative image from a micrograph of a parathyroid tumor. Note that this parathyroid tumor capsule surrounds the soft tissue. Interesting. Let's discuss primary hyperparathyroidism, which is a disorder of the parathyroid gland itself, which causes primary hyperparathyroidism, which is characterized by excess parathyroid hormone. To the right here, we can see the difference between an adenoma and an adenoma with the capsule. Interesting. Now, what are some causes of primary hyperparathyroidism? Well, parathyroid adenoma is the most frequent cause, accounting for about 80% of cases. Other things that can do it include sporadic parathyroid hyperplasia and parathyroid cancer. Although primary hyperparathyroidism usually causes asymptomatic hypercalcemia, it can also manifest as a condition with elevated parathyroid hormone and hypercalcemia, such as nephrolithiasis and nephrocalcinosis. Nephrolithiasis is kidney stones. Nephrocalcinosis may occur due to renal tubule metastatic calcification, perhaps causing renal insufficiency and polyuria. Symptoms of primary hyperparathyroidism may include CNS disturbances, depression, seizures, constipation, peptic ulcer disease, acute pancreatitis, and osteitis, fibrosa, cystica. By the way, osteitis fibrosa cystica is bone resorption resulting in cystic spaces and fibrosis. Now, some laboratory findings that you should be aware of regarding primary hyperparathyroidism include increased serum parathyroid hormone, increased serum calcium, decreased serum phosphate, increased urinary cyclic AMP, and increased serum alkaline phosphatase. The afflicted gland is surgically removed as part of the treatment. Now let's switch gears and discuss secondary hyperparathyroidism. Right? Unlike primary hyperthyroidism, secondary hyperparathyroidism is a condition wherein there is an excess production of parathyroid hormone due to a disease process extrinsic to the parathyroid gland. Chronic renal failure is the most common cause of secondary hyperparathyroidism. Renal insufficiency leads to decreased phosphate excretion, and the increased serum phosphate binds free calcium. Free calcium stimulates all 4 parathyroid glands. Increased parathyroid hormone leads to bone resorption, even contributing to renal osteodystrophy. Laboratory tests of secondary hyperparathyroidism include increased serum calcium, increased serum phosphate, and increased alkaline phosphatase. Hypoparathyroidism. Now, hypoparathyroidism causes the body to produce abnormally low levels of PTH. To the right here, we can see a CT scan from the brain showing diffuse symmetric parenchymal calcifications involving the cerebellodentate nuclei. This was related to widespread intracranial calcifications in a patient with hypoparathyroidism. Now, some causes of hypothyroidism include autoimmune damage to the parathyroids, surgery, right? Whether it's on purpose or incidentally, if there's damage to the parathyroids, or if all 4 of them are removed, or some are removed, parathyroid levels will decrease. Also, DiGeorge syndrome, right, can be associated with hypoparathyroidism. Symptoms of hypothyroidism or hypoparathyroidism include muscle spasms, Chvostek sign, which may be induced by tapping on the facial nerve, right? Trousseau sign, which is filling of the blood pressure cuff, right? That occurs then. Numbness and tingling. And laboratory tests of hypoparathyroidism show decreased parathyroid hormone levels and decreased serum calcium. Now let's talk about something that should be on the differential: pseudohypoparathyroidism. The cause of pseudohypoparathyroidism is end organ parathyroid hormone resistance. Laboratory tests of pseudohypoparathyroidism will reveal hypocalcemia and increased parathyroid hormone levels, right? PTH will be up. Now, short stature and a short 4th and 5th digits are characteristics of the autosomal dominant form of pseudohypoparathyroidism. And with that, you've completed a short but very important presentation. You're doing so great. Keep up the good work. You're making everyone proud. You're getting the knowledge down. You're going to succeed. You got this. Until next time, I'll see you later.